Welcome back. I'm Dr. Todd Janak here at Mount Dora Family Chiropractic, and in this video series we're talking specifically about pinched nerves, primarily as it relates to the neck. This can be from mild to completely debilitating depending on the degree and severity and the duration of the pinched nerve. So in this first video, what I wanted to talk about is, well, what is a pinched nerve? Let's start there, right? So let's just start with what a normal healthy spine should look like. This would be looking at the spine from the front. Okay, it should be nice and straight. When we look at your spine from the side, we should have these nice smooth flowing curves, 3 of them, okay, just like that. Now the first thing that'll typically happen that'll precipitate a pinched nerve is what's called a subluxation, which is going to happen from either macro trauma, car accidents, sports injuries, falls, things like that. More common today, even though, is the micro trauma. That's your repetitive strain injuries, postural injuries, like sitting at a computer for 8 hours a day, staring down at our phones, things like that. Ubiquitous today, of course. So over time, these traumas, you know, sitting in a chair with poor posture, the head's gonna come forward, we're gonna lose the normal curve. You know, maybe we fell off the skateboard when we were 3, we played some football and tackled, and in any case, the spine starts to take a beating over time, and because we're not generally taught to take care of it, it'll catch up to us. So when we have a subluxation, again, that's a fancy word for the misalignment. What's going to happen is going to create compensation, and muscle spasms are going to happen to try to deal with that misalignment, which is going to create altered biomechanics. Okay, kind of think like a car tire out of alignment, to use a simple analogy, which is going to irritate the joints, and on a long enough timeline, it's going to actually cause the joints and the disc to degenerate. Again, car tire out of alignment. Not an age issue, a biomechanical issue over time. There's a difference, right? So when that happens, once you have this irritation and degeneration, you're going to have inflammation. So you're going to see around that joint some inflammation. Okay, now that inflammation can certainly irritate the nerves as they come out of those openings there. All right, let me give you a better view of that. So if we take a section of spine here, you've got the vertebrae, okay, the discs are these guys in between. Now a lot of people think discs are shock absorbers. They're really not meant to be that. They're actually spacers, and they're creating a space for that nerve to exit, right? So if we were looking at from the top down, we're going to be looking like this picture. You got your spinal cord here, and then the nerve is going to branch out and come out. Well, the disc is necessary to create the space for the nerve. And by the way, what are those nerves doing? Everything. You live your life through your nervous system. Your brain is communicating to every organ, tissue, cell in your body through your nerves, all right? The good news is only about 15% of your nerve fibers actually feel pain. So if you're sitting there watching this and you're in pain, you're thinking, man, it feels like I feel everything. Well, 85% of your nerves are motor function, like your muscles. That includes your smooth muscle, which are your, you know, surround all your organs. And you got your autonomic nerves, which are like beating your heart, digesting your food, your endocrine system, and things like that. So you got different kinds of nerves, but the least of which is the sensory nerves, which you feel pain and temperature through. So again, another issue that can happen is through trauma and repetitive strain sprain over time is you can damage the disc, and that's where you get that bulge. So using this little example here, hopefully you can see on the camera, when we put pressure, you can see that disc bulge out there, and it's putting pressure on that nerve. Okay, so that's when you hear people talk about a herniated disc. That's what happens, and it can put pressure directly on the nerve or entrap the nerve. That can be quite severe and significant, but more often than not, we find that there's simply damage and inflammation, and that inflammation is irritating the nerve. So it's putting pressure around the area, but it's not direct. Nonetheless, what are we gonna have? Pain. Generally, not always. Sometimes you can just have numbness or pins and needles. We have people come in and like, well, I don't have a lot of pain per se, but I'm just numb and I get tingling and it's waking me up at night. And some people are losing strength. You know, I can't open a pickle jar. I can't carry things, right? That's the weakness. Or if you're lucky enough, you can have all 3, okay? So nothing to laugh at really, and obviously this can be going on in the lower back as well. So when you talk about pinched nerve in the lower back, you're thinking sciatica type symptoms with pain down in the buttock and in the leg, or radiating around through the groin. Can be quite excruciating. So in these next videos, I'm going to talk to you about how would you know if you have a pinched nerve, like what criteria, what tests can you do at home. And I'm also going to give you some things you can be doing at home to help get relief, okay? Obviously, if it's bad enough and it's and it's becoming chronic, you probably want to see a qualified healthcare professional, such as our office. You can go to your medical doctor. Their solutions typically going to be pain relievers, anti-inflammatories, muscle relaxers, and those aren't really going to correct the subluxation and the altered mechanics. So that's where a great chiropractor comes in. If you're not local here, we'll be happy to direct you to one in your neck of the woods, all right? Either way, we want to help. That's our mission. Thanks for listening, and tune into the other videos for more info. And if you find any of our videos helpful, please forward them to any friends or family who you think might benefit. Thanks for watching. God bless.